they're sterile only on the sleeves and the front from the waist up, stuff like that. So make sure you read that box. All right, so these are going to be some examples of where you might see sterile techniques being used. Tracheostomy is an operation performed using sterile technique. The doctor makes an incision in the skin first, and then a surgical incision into the tissues to expose the underlying tissue. Now, oftentimes chest x-rays will be ordered right after they place ETT tube. It's called an endotracheal tube, to make sure that it's in the correct spot. And whenever we show up with our x-ray machine, we have to be very careful to make sure that, we communicate properly to the patients. Oftentimes, these patients are very critically ill and they're not able to communicate because they have a hole in their neck. So you have to be very careful how you address them, make sure you let them know what you're about to do before you actually do it. So the purpose of this surgery is to provide an airway when it's obstructed. It's usually done in an emergency type situation, and ETT is just an acronym for endotracheal tube, okay? And tracheostomy is the actual procedure. Any questions? Yes?
This is the example of tracheostomy I had it when I was 20.
Okay,
4 years.
Shaheen had a procedure done.
Because when you put you on the ventilator and you have to save your vocal cords for
Exactly.
longer than a week, then they do the tracheostomy.
Yes. No, if there's any sort of obstruction in your airway and they need to help you breathe, this is done. Ready?
So whenever they do have it, they can't talk, correct?
Unless they have a tracheostomy with an attachment that lets them speak, but oftentimes they won't be able to communicate. So you have to use like hand gestures, etc.
So like whenever you have to ask them things like LMP and stuff like that?
For these type of patients, you wouldn't. You would probably ask that to the nurse.
Oh, okay. There was this one lady, she had one last week, and she had like a piece of paper and she was like writing.
Yes, good point. They usually have a little like notepad or something with them to be able to write down questions or whatever they need to ask their providers. Okay. So this is what it would look like. Trachs, they secrete a lot of fluid, so oftentimes you'll see that it has some sort of dressing or gauze on it. Make sure you guys never touch it without your gloves. And in any case, we shouldn't be touching it in the first place because that's not our job. And because they have all these secretions coming out, these patients often need to be suctioned also. So that would be a job of a respiratory therapist or the patient's nurse. And like I said earlier, we never touch the gauze or the dressing because that's an area of infection. By the way, that suction noise never gets out of your head. It's just always in the back of your head. Sounds like really bad Darth Vader sounds. All right, another procedure, thoracostomy. So these are known as chest tubes. I have one right over here. You guys can take a look and pass it around. So the purpose of thoracostomy is to drain the interpleural space from fluid or air. So we know that the space between what are the two layers called again? Parietal and visceral. So we know that air and fluid does not belong there. So anytime this happens, a chest tube is put in to remove that fluid or air, whatever the case may be. And chest tubes are extremely helpful in re-inflating collapsed lungs. What's the term for that again?
Atelectasis.
Atelectasis, yep. And so this helps with pneumothorax or any bleeding in the chest, which is known as hemothorax. And yeah, this is the procedure that's done for that. So this is what it would look like on a chest x-ray. Usually it's inserted in the 5th or 6th intercostal space, or it can go up to the 4th intercostal space depending on what they're looking for, okay?
5th counting from down or from the top, man?
Counting from the top. Mhm. So, we do a lot of chest x-rays. One of the reasons might be to check for chest tube placement. And they might be done as a portable chest x-ray, or these patients can come down to the department. So, when they come down to the department, or if we're there at bedside, it's very important for us to make sure we do not pull these tubes, either with our equipment or accidentally with our x-ray plates. That would be an immediate write-up. So in the tube view, we would take which kind of views for the chest x-ray? PN lateral, exactly. So when these patients get up from their stretcher to go to the x-ray board, make sure they don't leave their tube behind. And make sure the tubes don't get caught up anywhere. If you can put it in a chair next to them, or you can put it on the floor next to them. And also, it's very important to remember that chest tubes should be below the waist. Isn't that right, Mr. Donahue?
Yes, always.
Yeah. Make sure it's always at the level below the waist, because it's draining something, correct? We don't want it accidentally going back.
Excuse me, ma'am.
Mm-hmm.
Are these inserted? I was under the impression that they're inserted into the lungs or no?
Yes, they could be inserted into the lungs or the pleural space.
But then it's fitted with the patient, right?
Correct.
And must be on a hold or something.
Yes, they usually hang it on the side of the stretcher if they're coming down in a stretcher. So x-rays are also taken when the lungs have fully expanded as well, not just to check the placement. And after the pneumothorax has been gotten rid of and the lungs have fully expanded, that's another reason they would take chest x-rays. Where's the chest tube? Oh, there. So, there's 3 chambers, as you can see. We have the drainage chamber or the collection chamber, which collects any fluid leaving the lungs. And we have the water seal chamber, which contains water. It kind of functions as a straw. You know, when you have a straw and a cup of water, you can blow bubbles into the cup, but it doesn't come back, correct? So that's exactly how it would function. So it prevents air from the atmosphere entering the pleural space, but it does not return. And then we have the suction control, which also has water, and it controls the amount of suction.
Do the size of these machines vary per patient, or are they all kind of standard? Like if you put it on a kid, the smaller one?
Do they have pediatric chest tubes, or are they
They're
standard?
usually the same exact size.
Oh, okay. We good? Alright. So indwelling catheters are any catheter that dwells inside the patient's body. One example is our urinary catheter. There's 2 types. The retention balloon, most commonly known as a Foley catheter, and then there's a straight gap that does not have a balloon. So this procedure is done using aseptic technique. With the Foley catheter, after it's inserted into the patient, the balloon is inflated to make sure that it stays in place and that it doesn't come out. And it's also usually inserted during surgery, when a patient's under anesthesia, you know, they need to drain their bladder. And this is a way for them to keep track of that and also keep track of urine output. On page 221, it lists the many reasons for urinary catheter insertion, so make sure you look at that. Straight caps are less commonly used. I haven't seen them being used as much as a Foley catheter. And remember, straight cats are simply straight tubes, no balloon. These are just primarily meant for quick drainage of the bladder and not intended for long-term use. Yes.
This is page 221.
223.
Yes, page 221. Bottom right.
So how long do they usually have?
I'm sorry,
How long do they usually have in healthcare?
the straight cat or the Foley?
Both.
Well, the Foley is more commonly used. That really depends on what
They need it for?
yeah, what they need it for.
The straight is like just during surgery.
Mm-hmm. Alright, that is a picture of a Foley catheter. You can see that it's inserted through the urethra, and we have the balloon inflated in the bladder to make sure that it doesn't come out. And we also have an area here that can be used to inject water or contrast, whatever the need may be, into the bladder. And these are some reasons why a Foley would be used.
We don't have to do this, right? Or do we?
Yes, you actually do have to count on a patient.
I can't
I'm
tell.
kidding.
Okay.
I was like, this is it for me.
I
It's like I draw the line, that's
Yeah.
He's
That's
like,
why I left
is it too
nursing,
late
I
to
don't
go
want to
to
do
the-
it.
Should I get a break from that?
Make sure you palpate.
You said that was such a straight face. No, I was like.
There's different rules.
That's why I don't want to do nursing, you know, like.
Yeah, that's.
Alright, and this is just
Varies.
a picture of what it would look like on a female. For example, during surgery, like I mentioned earlier, it would be taped to the thigh, and then we have a chamber that monitors the output. And of course, the drainage bag must be kept lower than the patient's bladder. We don't want any backflow, that's just nasty.
When are they doing epidural? Like, do they do it bonuses?
I would think so, they would do a Foley tube for, women that are giving birth, correct? Yeah. Also, male patients, also can use a condom catheter, which is a specially designed condom with a catheter at the end attached to a collecting bag. So for male patients that may have incontinence issues, this is a good option. However, this one does, have a more risk of infection unless the condom is continuously cleaned. The tip of the penis is an area that might get infected if it's being continuously worn, okay? Oh yeah, it's painful. So this is a picture of a Foley catheter, and this is the shot of the balloon, and what is that? The bladder with what? Contrast. So, there's a procedure called a voiding cystourethrogram, or a VCUG. It's a study used to look at the bladder and the urethra to check for any abnormalities, or if there's some sort of reflux where things are going back up, not down. Okay? So trauma can cause that, any urethral infections can cause that. So this study is used to check for that. So the patient, so the patient typically lays flat on their back for this exam, and then the radiologist inserts the Foley through the urethra, and then contrast will be injected into the bladder. And images of your bladder will be taken during the filling of the bladder and then also the voiding of the bladder. So images will be taken while the patient is urinating to make sure there's no reflux, that it's not leaking anywhere, and this usually takes about 30 to 45 minutes. Okay? Yes.
And you said you, the urologist will do all this stuff? or-
Correct.
Okay.
Mhm. So another place where you would use Sterile Technique is when you insert a line into a vein or artery. One example would be a PICC line, which is a peripherally inserted intravenous line. And we do so many chest x-rays, especially at MD Anderson for PICC lines. There's nurses that just walk around all over the building inserting PICC lines into everyone. That's their job. And what do you think a reason might be for inserting a PICC line? Yes,
Fix an arrhythmia.
I'm sorry,
To fix an arrhythmia, right?
that's pacemaker. Yes, chemo? Not necessarily.
Fragile veins.
Fragile veins, exactly. So, for cancer patients, you know, they're getting chemotherapy, their veins are not very good. So PICC line is a great option. It just stays in place. It prevents them from being poked all day long. So this is one way to administer medications, do blood draws, whatever the need may be.
Also deep veins when you can't find them.
Yeah, when you can't find a good vein or their veins are just fragile. So yes, whenever we do take chest x-rays, make sure we're not pulling any of these lines. We have to be, especially in ICU, these patients have so many lines going all over the place. So we have to be very careful when we place that detector behind the patient that we're not pulling any lines. And Jay just mentioned this earlier, a pacemaker is an electromechanical device inserted under the patient's skin. They're typically 1 inch wide and just a little over 1 ounce. And they're typically placed either in the right atrium or the right ventricle. And the purpose of this is to do what?
Fix an
The
arrhythmia.
rhythm.
Regulate the heart rhythm, exactly.
So,
Yes.
I forgot the name of the procedure I had done, but I didn't get a pacemaker or anything like that. They just went in through the groin, the inferior vena cava, and went in with like catheters and like shocked certain nerves to fix an arrhythmia. I'll get back with you on the name of that procedure, but I had that done twice.
How old were you?
18.
I've never heard of that before.
Is that when you got electrocuted?
Mm-hmm.
So our goal in providing imaging skills for these type of procedure is to operate the C-arm or to take x-rays, chest x-rays. Shamika, you okay? You just look confused.
Oh, I'm trying to stay. No, I'm visualizing something.
O-arm. What is the O-arm?
It's
I've never
basically
seen one.
like a mobile CT unit.
Portable CT.
The X-ray techs are allowed to use without CT certification.
Oh.
It's a gigantic tanker machine.
Where, at the top?
It's essentially a mobile CT.
It's an arm, like in the meat? Oh.
Alright, so this is what a chest x-ray looks like with the pacemaker. You can see the leads are going into the heart. And it's placed under the patient's skin. Okay? Alright, this one is very important. Neonatal portal radiography. So these are very high risk infants. We have to be extremely careful. At Bentov, whenever I was working there, I remember you walked into the unit and you immediately had to wash your hands, put on hair cover, mask, and sometimes shoe covers, because these babies are at high risk of getting infections. So we have to be extremely careful that we're hand washing, because they have secret shoppers that are observing you to make sure you're doing the right thing. If not, that's a write-up. They don't need to know your name, they don't need to know your badge to know who you are or figure out who you are. So be extremely careful. So for these kinds of patients, the nurses are the ones that are usually adjusting the patient. We don't typically touch them. They would use these little openings to put their arms through and then adjust the baby according to where we need them. And then underneath, there's usually a little slot that pulls open for us to put our cassette detector in. And then there's two types of shields that could be possibly be used. One is the contact shield, which is a tiny little shield for their gonads, or shadow shield, which is part of the tube housing itself. It just places a shadow in the path of the X-ray beam in order to prevent contact.
Like the collimators?
Yes.
When this baby's in an incubator, that
Yes.
hand thing is for, they always have a place to put the hands in the incubator.
At Bentab, I think so, yes. I don't know about Texas Children's.
We got to manipulate and touch them depending on how critical they were. Like a patient like this would be higher critical, like you would not be able to touch, but like the more stable ones, we'd be allowed to help manipulate them and even put cassettes directly under them a lot of times and position them, because we have to do a lot more than just chest x-rays, we do like skeletal surveys and all kinds of other exams as well, so a lot more hands-on at Texas Children's with the
So my
neonates.
question was, all incubators have this place to put the hand inside?
No.
No, I didn't
But
see.
it depends on the level of criticalness of the patient.
So they're different type of.
Yeah.
No. So the slot is attached to the side of the incubator, so we're not lifting the baby up to put it under the baby itself.
Oh, okay.
We can move the baby up or down to better center the baby, but it's not going under.
Oh, so their incubators have buttons in it.
Mhm. Yes. Well, they're not really buckies, they're just like little slots.
Yeah, it's just like a little tray that comes out, that you can put your cassette in.
So what do you do, like a 10 by 12?
10 by 12, yes. And also, the X-ray tube will not be directly over the baby, because remember, these are high-risk infants, so it would just be placed on top of the incubator through the covering.
Is the covering radiolucent?
Yes.
You said the secret shoppers are gonna be in there. Would you get ejected or like removed from the case if you just walk in and like not sanitize or whatever?
I would say it depends on the person. They might call down to the department and say, can you send somebody else up, because this person does not know what they're doing.
Yeah.
And you wouldn't use like a marker on here?
You can place a marker before you put the cassette under the, or into the slot, like on the bottom corner or whatever you're doing.
Well, isn't that hard to tell if it's gonna obstruct the anatomy? Cause you can't really see how much
I'm assuming you put it at the very corner.
Well, if you're doing a chest, you can put your left marker in the very top left corner, or if you're doing an abdomen, you can put it on the bottom right corner.
You learn how to do that, you learn how to shoot blinds, we'll figure all that out.
And this is this picture is, I could not get clear pictures. This is an example of a shadow shield. It kind of is attached to the tube housing. If you can see, this is the X-ray source right here. And then this one, you can see primarily in the OR. It's like a glass shield made of lead, or that has lead. And typically the surgeons will go run and hide behind that when you're shooting X-rays or fluoro, if they don't have lead on already. All right, portable and surgical radiography is another area where we use sterile techniques. You will never walk into the OR without a hair cover or a mask. Do not do that, or they will look at you like you're crazy. Be careful of the sterile corridor. What is a sterile corridor again?
It's between drape and patient table.
Between the patients that's draped and then the scrubs tech's table. And then of course we're going to drape our C-arm. By the way, where is the image receptor on the C-arm? Image receptor?
At the
Oh,
top.
at the top is one.
Right there. So that's what will be draped. Some hospitals do drape the bottom as well, but I think when I was at Bentab, they would just use regular trash bags. Because it would get super bloody, so they can just rip it off out of the case. Alright, so that's what our C-arm looks like. at Bentop and LBJ. Who's been in OR? So you've already seen this. So the image receptor is draped all the way down, and it's also held in place by tape or tension bands to keep it in place. Because you don't want this all flying all over the place when the patient is sterile. And then this could either be left open or covered, depending on the area. They want it covered? Yeah, especially orthopedic cases, it gets very, very bloody. So, like I said earlier, it's important for us to wear our hair covers, our mask, and sometimes even shoe covers. I would highly recommend it, because your shoes will get dirty and bloody. Be aware of the sterile areas, know who the nurses are, who the scrub tech is, and take charge of your area. Sometimes people like to pretend that, you know, they know more than you, but they're not a licensed tech, so do not let them mess with your equipment. Do not let them contaminate your C-arm. And then make sure you know the team. Your life will be a whole lot easier if they know who you are, if they know you by name. They could either ignore you and be really mean to you, or if you try to make conversation, they'll help you out. And then don't be afraid to speak up, especially the surgeons. Don't be bullied by them. We already heard about Dr. Perkins at Bentop. We used to have a vascular surgeon at Bentop. His name was Dr. Gilani. Wilson knows. He was notoriously rude. I remember one time, I think it was my first or second semester as a student, and the surgery table was not working. It wasn't moving back and forth how we wanted it to. So then they had the equipment tech come up to check it out. And he was wearing a bunny suit because he didn't have the proper OR scrubs. Anyway, he got under the table, pushed a bunch of buttons, and he was like, I'm not sure exactly how to fix this. So then the doctor was like, oh, so you just came up here looking like a bunny? We just need to give you some carrots and put some cotton balls on your butt to make you look like a bunny. I was like, oh my God. And then I was just like mortified, and my x-ray tech started laughing. So he looks over and he's like, oh, you think that's funny? And I was just like, I'm not here. I am not here. But yeah, apparently he's gotten a lot nicer recently. Bentop, yeah. So anytime you had a case in OR number 3, you're like, I'm not going. But that's his room. Alright, we're going to watch a little OR video.
We can't see the video. Itself. Anytime you go from an AP to a lateral, they have to have a sterile cover.
Is that because it's at the level of the waist or higher?
Because sometimes the x-ray tube itself won't have a surgical or a sterile cover. It's just like a regular plastic bag. but because it's going to be next to the patient, you want it to be sterile. Shower curtain. This is another type of sterile drape. It's primarily used in orthopedic cases, especially for what's called hip pinning. So we have 2 vertical rods here, and then a horizontal one, and then the affected side where they will do the surgery is right there. So for this procedure, our C-arm typically will not need to be draped because we're only going to go on this side. But going from AP to lateral, they will have a sterile cover on the other side. Okay? Alright, so bags for biohazard waste are used in hospitals and other healthcare facilities to safely collect and dispose of hazardous medical waste, such as soiled linen, any gloves that are bloody, dirty gowns, etc. And they have to be thick and marked infectious waste or biohazard. You do not dispose of biohazard waste in regular trash cans, okay? And like I said, the plastic bags have to be printed with the words and symbols, which helps to identify what's in it, and also make sure that people know exactly how to properly dispose of these wastes. And then commonly included contaminants are anatomical waste, such as body fluids, fecal matter, semen, tissues, saliva, etc. And then we have our sharps container, clearly labeled sharps, and that's to dispose of needles, exactly. And please never reach into the sharps container with or without gloves. You do not want to be contracting any infections that you did not come to the hospital with. So don't reach into sharp, yes.
Okay, you just answered it.
Yes. You can throw needles in there, but just don't go reaching in there. Okay, any questions? That's it. Chapter 18 done.
I have a question.
Yes.
On the video, if she would have had gloves on, would she be able to